we are going to look at the normal anatomy of neuromuscular junction. As we can see here, this in image, the normal anatomy of neuromuscular junction is this one is presynaptic membrane, this one is postsynaptic membrane, and here is synaptic space. From presynaptic membrane, these vesicles full of acetylcholine release acetylcholine in the neuromuscular space. So these vesicles bind with the receptors present on the postsynaptic membrane. Postsynaptic membrane receptors are there where acetylcholine is binding and contraction is generated into the postsynaptic membrane. So this is normal mechanism. Then this acetylcholine is broken down into acetylcholine esterase for reuse purpose. Now what happens when we give neuromuscular blocking agent? These agents act on different parts. Some agents bind competitively on the postsynaptic membrane and causes depolarization first and then repolarization. Some agents bind but does not cause depolarization. Some agents bind with acetylcholine and neutralize it, acetylcholine esterase, and neutralize it. So these three type of agents can work in different mechanism for neuromuscular blockade. Now first agent that I told you, which bind in the receptor on the postsynaptic membrane and cause initial depolarization, are depolarizing agent, and we call them succinylcholine. Succinylcholine is short acting, used in emergency procedures for neuromuscular blockade, and they cause depolarization, and their side effect is fasciculation. Another one is atracurium. Atracurium bind with the postsynaptic membrane and they are inactive. They does not cause depolarization. That's why called non-depolarizing agents. Their side effect is histamine release and hypotension. So we have to memorize this. Third one that I have told you, which bind with acetylcholine esterase and neutralize it, are neostigmine and used for reversal of neuromuscular blockade. Acetylcholine esterase break down acetyl and choline portion for reuse. What happens when they bind with acetylcholine esterase? Increased concentration of ACH will be there, and more acetylcholine means more contraction and result into the reversal of the blockade. So this is the normal mechanism of acetylcholine esterase. These three agents bind with different mechanisms and causes different function. So in this way we have to memorize these normal anatomy as well as normal physiology of the neuromuscular blockade. As you can see here, the nerve terminal and acetylcholine receptors are there. Okay, so as I told you that there are two types. One are non-depolarizing agent, that is succinylcholine, sorry, non-depolarizing are atracurium, and depolarizing are succinylcholine. Side effect of succinylcholine is fasciculation, and side effect of atracurium is histamine release and bradycardia. So these are depolarizing and non-depolarizing agents. Next one is when these agents bind with the receptor, decreased binding of acetylcholine results into decreased effect on the neuron, and generally that non-depolarizing agent block it by reversible and competitively inhibiting the nicotinic receptor on the postsynaptic membrane. Then what happens? Then postsynaptic neuromuscular blockade happens, and there are some long acting and intermediate acting and some short acting are there, which you have to memorize that what kind of drugs are long acting, short acting, and intermediate acting. So there are different side effects. As I already told you that atracurium has side effect of hypotension with renal failure and histamine release, and other medications have some other side effects. So the action of atracurium and these other blockers is inhibited by neostigmine or pyridostigmine. These agents are used for reversal of blockade That's why called reversal agent. There is the different mechanism that I already mentioned, that acetylcholine esterase binding results into reversal, there is a whole mechanism succinylcholine, which is the dose of succinylcholine is 1 to 1.5 mg per kg. The dose produces profound blockade for 60 seconds, which is faster, and a very short duration is there for 5 to 10 minutes for plasma cholinesterase to hydrolyze the succinylcholine. So it is used in emergency procedures. Adverse effect of succinylcholine is bradycardia, muscle pain by fasciculation, and hyperkalemia. So you do not have to use it in burn patient, rhabdomyolysis patient, or any muscle pain patient, or any patient that have hyperkalemic condition. So you have to take care of this one. So this was all about neuromuscular blockade, normal physiology, and some actions related to these.